Depression in children. In this video, we'll be looking at a number of important concepts relating to depression in children. These include 1. Important facts about childhood depression. 2. How is childhood depression different from the blues? 3. Causes of childhood depression. 4. Signs and symptoms of childhood depression. 5. How is childhood depression diagnosed? Let's get started. Depression isn't common for children under 12, but it does occur. Childhood depression is different from the normal blues and everyday emotions that occur as a child develops. Just because a child seems sad doesn't necessarily mean he or she has significant depression. If the sadness becomes persistent, or if the disruptive behavior that interferes with normal social activities, interests, schoolwork, or family life develops, it may indicate that he or she has a depressive illness. 1. Important facts about childhood depression. Childhood depression is a risk factor for developing a number of other mental health symptoms and disorders. Depression affects about 2% of preschool and school-aged children. Suicide is the third leading cause of death in youth 10 to 24 years of age. Depression in children does not have one specific cause but rather a number of biological, psychological, and environmental risk factors that are part of its development. Interpersonal therapy, ITP, and cognitive behavioral therapy, CBT, are the major approaches commonly used to treat childhood depression. 2. How is childhood depression different from the blues? Childhood depression is different from the everyday blues that most kids get as they develop. The fact that a child feels sad, lonely, or irritable does not mean he or she has childhood depression. Childhood depression is persistent sadness. When it occurs, the child feels alone, hopeless, helpless, and worthless. When this type of sadness is unending, it disrupts every part of the child's life. It interferes with the child's daily activities, schoolwork, and peer relationships. It can also affect the life of each family member associated with the child. 3. Causes of childhood depression. Physical health. Major life events like the death of any one of the parents or a close friend or relative. Family history. Genetic vulnerability. Biochemical disturbance. Bullying at school or at home. 4. Signs and symptoms of childhood depression. Change in appetite. Change in sleeping habits. Reduced energy. A vocal outburst or crying. Impaired concentration on studies or games. 5. How is childhood depression diagnosed? If your child has symptoms of depression that have lasted for at least 2 weeks, you should schedule a visit with his or her healthcare provider. A consultation with a mental health professional that specializes in treating kids with childhood depression is recommended. A mental health evaluation for childhood depression should include interviews with the parent and your child. Psychological testing may be helpful for clarifying the diagnosis and making treatment recommendations. Information from teachers, friends, and classmates can be useful for showing that the symptoms of childhood depression are present during your child's various activities and are a marked change from the previous behavior. There are no specific tests, medical or psychological, that can clearly show childhood depression. But tools such as questionnaires, for both the child and parents, and interviews with a mental health professional that include taking a careful history can help to make an accurate diagnosis.